So I have case number 3. It is a person with bilateral lower extremity paralysis, and they also have sensory loss below the T10 level, secondary to a spinal cord injury. So they fell out of the wheelchair and they need instructions on how to get back up from the ground. So I'm the patient here, and I'm on the ground. The way to get up from this position, if I were the patient or instructing a patient, would be for them just to use their upper extremities to lift themselves up from the ground. And a little bit of core strength too, putting them in flexion. So just moving up just like that. Next, I'm going to have them lift their lower extremity over the other leg here. And we're also going to have them rotate and use some rotation strength to get into a mermaid position. So bringing them over here. Since they're unable to use their lower extremity, we're going to have them scoot over to the wheelchair. The final step here to get into the wheelchair is to put the forearm on the seat of the wheelchair and their hand on this part of the wheelchair. You can also have them put it up here, but I just prefer it down here. It makes it a little bit easier to get up into the wheelchair, and you're just going to use your upper extremity strength to pull yourself up into the wheelchair. Okay, you can rotate back forward and then just lift this leg back over. When it comes to caregiver instructions, basically you're going to have them go down here, and you're going to bend this knee here and get them into a position where you can roll them over onto your side.
I'm giving myself
So I'm just going to go ahead and
I know.
bend the knee
I had a
here.
cut on my knee yesterday. That's why I wore pants.
Okay. Just going to also kind of
But then like trying to scoot and pulling your pants.
Yeah. To the side here.
Oh.
Okay. I'm going to roll you over onto your side and count 3, okay? 1, 2, 3. Good. Now with the patient here, you can have them use their upper extremity strength that they have to get them into a position called mermaid position. So I'm just going to have you go ahead and use your arm to push yourself up. Good. Almost done here. Now we're just going to have the patient scoot over to a table here using their upper extremities. So you can go ahead and do that. Kind of guide them over to the final part here, just having them put their forearm onto the chair and their other hand onto that part of the wheelchair, and you're just going to help them be guided up using the gait belt here, using moderate force to help bring them up. Okay, so on the count of 3, I'll help you get up into the chair here, okay? Okay. 1, 2, 3. I'm going to reposition them. Okay. You're good.